Hello friends, welcome to my channel. I am demonstrating PCL reattachment. Here ACL appears, there is a sagging, and we are creating the space between ACL and PCL using the shaver, and then we will then use the RF. Once we create the space between ACL and PCL, we will be using this to put the scope and also use the thread or the fiber wire which will be looping around the PCL and the bone interface. This is the another space just medial to the PCL, that is between the PCL and the medial femoral condyle. We are creating a space. So basically we have to create a space between medial and lateral to the PCL and then pass a loop around the PCL which is going to held between PCL, that is a ligament, and the bony avulsed area. You can see, as I have demonstrated, I have written in the lateral and posterior schematic diagram. That is the concept. To pass the loop around the PCL and tie it behind, we need posterior medial and posterior medial up and one superior, one inferior portal. We can also create posterior lateral and posterior medial. Here I am demonstrating posterior medial up and down. I am viewing from above and working from below. Now you can see the red color is a PCL which is stretched and avulsed. We have to create a space behind the PCL using the RF and shaver. Now we are creating a space. I am going past PCL, past the PCL in the center, and going as much as lateral as possible, so that once we take the loop, it will be easy for us to create the tunnel where lateral space which is not very clearly seen normally. Here are the two cannulas. This helps us working and viewing simultaneously behind. This is how we are going to pass the fiber wire. This is in the lateral, that is between ACL and PCL. Once we pass it, we are going to see from behind. We are poking with the suture retriever here and trying to see. If we are not able to see, again we will create a space. That is what I meant when I told that we are going to create the space lateral to the PCL. This is how now, after we created a space, as we put the suture retriever with the fiber wire, this is very clearly seen from behind. Now we can retrieve it from posterior portal, one of the inferior portals, because superior portals we will be viewing. Simultaneously, after this, the other end of the loop, we are going to take it from the medial to the PCL, so that this loop is around the PCL. Once we make the sliding knot, it will sit between the PCL, that is ligamentous, and the avulsed bony aspect. As we do it, then we have to see we are going around the PCL. Once we do it, then the next step would be to create two tunnels, that is 4.5 mm tunnels below medial and lateral to the PCL. This is what we are doing. We have retrieved two threads and we have made a sliding knot. Here now we are creating the tunnels of 4.5 mm, one medial and one lateral. This is a lateral most tunnel. We are viewing from the posterior medial portal and retrieving now the thread, that is the ethibond from the bead pin, and similarly we are going to pass the one of the threads of the PCL looped thread from the fiber wire. We can use fiber tape, also fiber wire, or two fiber wires also. Here you can see one of the threads, fiber wire, is already in the tunnel. Our work is to pass this also in the tunnel and then tie this in the front by keeping the knee in anterior drawer position. That completes this procedure. You are now seeing the jig. We are creating another hole, that is a tunnel just medial to the PCL. Basically, we have to create the plane between the PCL and posterior tibia and little below than normally what we do for PCL reconstruction, and and then we can pass the threads using the settling of the ethibond, how we are doing it now. The most important thing is to create two portals, and then you can see now V-shaped two threads going in two tunnels nicely, the same way how we have demonstrated in a schematic diagram. Same way it is done. If you have liked it, please like it. If you find it useful, then please subscribe to my channel, and also share this to some of your friends and someone who will be benefiting from this kind of videos. Thank you very much.